Now I'm going to move into breathing. So we've talked about airway. We've talked about the fact that we need to open, clear, and maintain. And this is kind of our mantra here. Open, clear, maintain. We open it with a manual maneuver. We clear it with suction if we need to. We maintain it with OPA, NPA, and continued manual maneuvers. All right, so open, clear, maintain. And that's it for airway. Open, clear, maintain. Once we've made sure that our patient has an open airway, we've cleared it, and we're maintaining it, we want to make sure that they're breathing. So we started with A for airway, remember? And now we're going to move into B for breathing. So what's normal? Normal rate, especially, so for an adult, 12 to 20 breaths per minute. A child is 15 to 30, and an infant is 25 to 50. Now, I'm going to go ahead and point out what some of you guys may be frustrated with is I don't know that these are the exact same rates that are listed in the other lectures. I think one of them said adults normal was 12 to 24. Children was, 15 to 38 or something. And infants were 30 to 70 or something like that. Here's the thing. Normal rate is going to vary from patient to patient. And it's going to be based on their body size and their needs. So somebody with a smaller body size may not need to breathe as much, or they may need to breathe more depending on their lung size. Ultimately, what your job is to verify that their breathing is effective at getting oxygen in. So O2 is oxygen, oxygen in, and CO2 out. So we got to get oxygen in and CO2 out, and those are the two main functions of breathing. Rate is going to be one indicator that they're doing that, but it's not the only thing. So we have to look and say, okay, is their rate about normal? Maybe it's 22. Maybe that's normal for them. Maybe they're a little upset about something. The other things we want to look at are rhythm and quality. Are they breathing regularly, or do they have a pattern to their breathing? We'll talk in a different lecture about some patterns that they may have based on medical conditions that may happen. But suffice to say, there are different patterns, and fairly regular breathing is normal. The big thing, I think, though, is adequate quality. So we need to have movement of air at the mouth and nose. This is the part where we listen and feel, especially if our patient's unconscious. It gets a little weird if you try and stick your face in somebody's face if they're conscious. You can ask them how well their breathing is at that point. We also want to assess their chest expansion. This may require that you basically take off their shirt if you're having a hard time seeing. Make sure that breath sounds are present and equal, so you're going to use your stethoscope to auscultate the chest. And you want to make sure that they're not only clear, meaning there's no funny sounds, but we want to make sure they're actually there, and that they're equal on both sides. They should have a minimum effort for breathing, so make sure that they're not working really, really hard, and make sure that they have adequate tidal volume. Tidal volume is a fancy word for depth. How deeply are they breathing? Abnormal rates, well, anything outside of the normal range. Could be an irregular rhythm. And the biggest thing, again, I'm going to say here is inadequate quality. This is key, really assessing the quality. So if we have absent or reduced airflow at the mouth and nose, if we have chest expansion that is either inadequate or asymmetrical, if your breath sounds are diminished, unequal, noisy, or if there aren't any, then that's a concern. If you have significantly increased or even moderately increased effort of breathing or the use of those accessory muscles, which I have talked about before, or an inadequate or shallow tidal volume. So I want you guys to do this now. I want you to take and put your hands on your ribs, kind of just the bottom half of your ribs, and take a normal breath. And you can feel what for you is a normal tidal volume. Now I want you to take a big deep breath. You can feel how much more your ribs move. Now just take a really shallow breath. Your ribs don't move as much, and that's your shallow tidal volume. If you combine a shallow tidal volume with a low rate, like here, a low rate, that is going to cause ineffective oxygenation and ineffective ventilation. So you're not going to be able to get that carbon dioxide out as well. Other signs that you may not be breathing adequately. The early signs are going to be that your skin is pale, cool, and clammy. The late sign is that you're actually going to start turning blue. Cyanosis, which means blue, basically blue skin, or you're turning blue at the lips, the nail beds, and sometimes in the face. This is a late sign. So if you're showing up on scene and your patient's already starting to turn a little blue, that's a big deal. Other indicators that you're inadequate with the breathing are retractions of the soft tissue above the clavicles. So clavicles are your collarbone, so everybody find your collarbone. Feel that. Now go just above your collarbone, as close to midline as possible. Those soft tissues in there, when somebody's working really hard to breathe, will actually suck in and push out a little bit, and suck in and push out a little bit. That same retractions you'll see between the ribs and below the rib cage. You may see the patients are actually flaring their nostrils a little bit, so think about trying to open your nostrils up as wide as possible to take in as big a deep a breath as possible. And then in infants and small kids, you may get what's called seesaw breathing, and this is actually they're belly breathers, meaning they can't expand their rib cage as well to breathe, and we'll talk more about that when we talk about pediatrics. But you may see it actually looks like when their belly, so let me see if I can do this here. There's a chest and the belly, and there's your kiddo's neck and their head. Okay, there you go. That's a really big kid. Anyway, so this is their stomach. Their stomach will go up and their rib cage will go down. And then their rib cage will go up and their stomach will go down. And so it actually looks like a seesaw moving up and down.